Medical workers of Reddit, what were the most haunting last words you've heard from a patient? My husband is a PICU nurse, and one morning he came home in a bit of a daze. I asked him what was wrong, and he told me about a little boy who had been in PICU for a few days already and wasn't getting better. Most nights, the little boy would wake up, so one of the nurses would keep him company while he fell asleep again. My husband was doing just that. He read him a book, then just sat there with the boy listening to music, so he would go back to sleep. Before falling asleep, the little boy said, "You were my favorite." The boy passed away in the morning. His little heart gave out and refused to restart. Although all patients are important, some leave more of an impression than others. Until that point, that little boy hadn't stood out to my husband, and he felt terrible about it because, clearly, he had made a big impression on that little boy. That was the only patient's funeral he has ever attended. Get allergy tested if you have asthma. The amount of doctors who don't do allergy testing for persistent asthmatics, which is recommended in the NE guidelines, is ridiculous. 9 people die a day due to asthma. 3 moderate, 3 persistent, and 3 severe. No one is guaranteed safety. Get allergy tested so you know to reduce your triggers. RN here. I don't remember this guy's admitting diagnosis. He wasn't assigned to me, but my coworker asked me to help start and forth on him. He needed a unit of blood and his peripheral access had gone bad. I placed a tourniquet and was ready to stick. Then he looked at me and said, "I'm dying." Immediately went unresponsive. I checked his pupils. I watched one dilate and the other constrict. We coded him, never got him back. When I was a senior resident, a young man, late 20s, was admitted for pneumonia. He got worse quickly, and I was called to his room to help. While on call that night, he was having trouble breathing and needed intubated. I explained all this to him, and that I would sedate him and then get him intubated, so we could help him breathe. He agreed and we got everything ready. The last thing he said to me was, "Doc, please don't let me die." I told him I would do my very best. I got him intubated and transferred to the ICU. A few weeks later I was on call covering the ICU, and he was barely hanging on. I knew he would not make it through the night. He went into VFib several times, and I was able to bring him back, but only briefly. He was just too sick, and he died shortly after that. It was horrible talking to his mother and girlfriend, and comforting them knowing the last words he ever spoke were to me saying, "Please don't let me die." Not the very last words, but I had a patient in her early 20s who was severely thrombocytopenic and bleeding profusely for days ask me if she was going to make it. I had to look her in the eyes and tell her there is a good chance she wouldn't. I thought she would bust into tears, but no, she just kind of sat back and accepted it. I think she already knew. She died shortly after I got off shift. Not haunting, but it went so. This is what retirement is. Like he got hit by a car within a few days of retirement, and it has to be the funniest last words. Normally they are sad last words. Edit. Thanks for the silver and all of the likes, it has made my day. Hope you all are having a great day as well. Edit 2. This is the most likes I've ever had. It's my first comment to cross 500 likes, and I has over 7,000 and growing. Thanks again. Not a medical worker, but I knew a guy from middle school, degenerative disease, and he knew he'd die young. It was New Year's Eve and he'd just gotten out of the hospital for the 3rd time in a few months, so we were partying at his apartment. Somehow I ended up being the last person there with him and his girlfriend, and we were pretty drunk and got to talking for a while about how great the party was, how much nice it was to have friends like ours, plans for the future. All of a sudden he said, "God, I wish I had more time. I always thought I'd have more time." Not his last words, but they're the ones that stuck with me. We weren't close by any stretch, but I always wished he had more time too. He was so friendly and kind, the type of person who made you feel like their closest friend, even if you were a total stranger. He was a good man and he deserved a longer life. Not a medical worker, but I went with my father to say goodbye to my great uncle, his uncle. He was suffering from dementia and clearly on the way out. He no longer recognized people. My father was an only child and spent most of his time being raised by his uncles, as his father ran a farm all day. Anyway, we are sitting there and great uncle is snoozing. he suddenly wakes up and clearly sees my father and starts talking to him about a barn and describing it in great detail. Like, he's talking about where it is, the way the paint was flaking off in one corner, and so on. My father is quieter than normal and just saying yes over and over as he describes the barn. Then, just before great uncle loses consciousness, he describes going into the barn and setting it on fire. Turns out that my grandfather and great uncle were having a hell dispute at one time and burned down the barn to get back at him. Everyone suspected, but never knew for sure. Edit. Looks like I forgot the last words. Most of them were mumbles, but he spoke about how the fire lit up the night and how it took a while to catch. Obligatory not a medical worker boo-word. Famous author Roald Dahl had planned his last words to be, "You know I'm not frightened. It's just that I will miss you all so much," to his family. Instead, the nurse injected him with morphine to relieve his pain and his last words turned out to be, "Ow, fuck." Not a medical worker, but when I was 14 my friends and I were joking around before our 7th period theater class. My one friend, who was always a big goof, was playing along with a joke that he and another classmate were breaking up and said, "This relationship is over." Then spun around and fell to the floor for dramatic effect. Except it wasn't for dramatic effect, because he actually suffered heart failure and died instantly from an unknown condition, acute myocarditis. None of us realized it and laughed along. I even picked up his glasses from the floor and put them on to tease him about how blind he was. When I tried to give him his glasses back I was struck by how discolored his face was, and then blood began to pour from his mouth. That's when the screaming started. Absolutely fucked me as a 14-year-old to realize we could all just drop dead at any moment. I'm an emergency nurse, and there's one thing that always gets me when patients die. Not what they say, but what their husband/wife/parents say when they've gone. I've had it a few times, but the most memorable was a man in his 70s whose wife had just passed away, and he was holding her hand and crying, and he just looked up at me and said, "I've loved her for 55 years, she's my whole life. What do I do without her?" It breaks me every time. I work as a PA for a clinic, so I'll never be involved in that situation, but I know a friend who has been. She is also a PA, and was helping a guy who was terminally ill. Before he passed he asked her to not let his wife have his shit. Of course she listens and is sympathetic. A day or so after he passed his ex-wife apparently shows up to the hospital with several kids saying she is in this guy's will. Long story short she was trying to take his shit. Both my parents work, so every time I say bye to anyone I love, I tell them I love them in case those are my last words to them. I don't feel sad or morbid about it, it's just that so many people regret not telling their special people how special they are when they had the chances. Nurse, in hospital caring for 40-ish man with brain tumor, coming in and out of consciousness, not to be resuscitated. His 16-year-old daughter was crying non-stop for 12 hours. His wife, who had been given a few months to prepare herself, was calm and focused on her husband. I had to routinely check his level of consciousness, which involved talking to him in a loud voice, responds to auditory stimulation, which I did not like to do. So I asked his wife to do the loud voice part, so the voice he would hear would be hers, not mine, and she did so without hesitation. The only response we observed with her vocalization was that this by now profoundly unconscious patient took her hand to his lips and kissed it. He stopped breathing very soon after that. I'm haunted, but not in a bad way. Not a medical worker, but my friend's husband was dying from cancer. He'd done lots of chemo and one surgery and overall his prognosis looked really good. He'd gone through another surgery and he was due to be released from the hospital a couple days after this story takes place. My friend had been with him and was going back home to sleep for the night. Just before she left his room, he said, "I'm going to miss you my love," and obviously she thinks nothing of it, saying, "I'll miss you too. I'll be back in the morning." Couple hours later he was gone. Not my patient, but a friend of mine. He had a patient with a AAA, abdominal aortic aneurysm. Your aorta is bulging and throbbing about ready to pop. The pain is very severe and agonizing, and if it does rupture, the pain immediately goes away and feels so good, but your chances of survival are pretty much non-existent, even if you are prepped on the operating table when it ruptures. Anyways, he had a 15-year-old with one, and on the way to the hospital she looks at him and just says, "Oh, that feels so much better," and died about 10 seconds later.